think and if it is okay like this. Okay. So when the streaming is going, we can start. Perfect. So welcome to all. Welcome from COP30 in Brazil. We are here in Belém at the Digital Innovation Pavilion. And today is a special day because it's the Health Day here in COP. In the agenda of the 2 weeks of negotiations, this day specifically is dedicated to 4 related issues regarding health and so forth. And so we take the chance today properly to talk about One Health. One Health, that is a concept that is very important, is a definition that nowadays has been also agreed by 4 UN agencies, WHO, FAO, the World Health Organization, and also UNEP, and is in a way something that is connecting the health of humans with the health of ecosystems and health of animals. We did just a few months before COP a conference in preparation of the COP that was like the 4th One Health International Conference. We had it in Rome at the Campus Biomedico Rome, Università Campus Biomedico Rome, and today we want to present a little bit the results of this effort that has been between the 29th of September till a full week, the 2 and 3 of October. So maybe we can go next slide, just to tell you a little bit about the conference. No, we will comment today with our honorable speakers that are connected here and also here in present, a little bit about the results of the position paper that today we are proposing properly here in COP. But what is One Health? What is the International One Health Conference? It's a space that has been created since 2021, proper to gather different professionals, different specialists, clinicians, medical students, but also engineers, architects, and so on and so forth, to talk about this proper concept of One Health. It's a space that wants to crossroad the different domains, and probably this has been the main and peculiar characteristic of the space since this year. Here you can see a little bit about the photos. Every year we make this conference in a different place. We started the first year from Catania. We will hear about that from Professor Ferrante, and then we moved to Greece and Rome this year. Which is the vision? So let's go to the next slide. The vision is to address health into the multifaceted aspect. With COVID pandemic, but not only, this is a concept that is very well known, at least from 20 years. Health is just not human health. It is connected to what is ecosystem health, what is also animal health. And our mission as a conference is probably to talk about that, to pass from interventive medicine to preventive medicine, the medicine that also is considering an holistic vision of well-being and so on. Let's go to the next slide. So during the year, the conference has invited a lot of experts, a lot of speakers from different fields. Here you can see the plethora of speakers that were, for example, in the previous edition in Greece, always around October, where we address also the Mediterranean concept of One Health. Let's go to the next slide. And this year, we try to address again this multifaceted dimension of One Health. Every year, we decided to have a framework. No, we decided to confront, like, to analyze the different aspects of One Health, decoupling in different dimensions, and each dimension is a track, for example, of the conference. Let's go to the next slide. This year has been very special. I don't know if you know, this year is the Jubilee year. We were in Rome, we can say, an iconic city, and we were there in a moment that was very important. And for us, it was very inspiring, the vision of Laudato Si. Laudato Si is an encyclic of Pope Francis that is a kind of manifesto of One Health, because it properly is talking about integral ecology, how if we take care of the earth, then we can also take care about our health. And so we decided in this iconic year to have as a framework the integral ecology. And we divided the conference in different domains pertaining the integral ecology concept. Next slide. So every year we are trying to present the results of the conference in different venues, like here. We organized the so-called twin event. We were present in different twin events since the last year, in the Global Pandemic Network Conference, in the Mediterranean Green Week, properly to bring the concept of One Health outside of the box, not only, you can say, in a clinical environment or medical environment, but also in every field of the human knowledge. Let's go to the next slide. And one peculiar thing that we are doing as organizing group and scientific committee of the conference is to present in COP, an important moment for decision making, a position paper. Okay? A position paper that want to highlight our statements, our points of action that we want to suggest to the policymaker when they are deciding about climate issue and so on, because climate is also an health issue. Today we want to recall very strongly this, because it's a health day, we are in COP, and we have not to forget that climate change is one of the first health threats. Before going to the position paper, first of all, I want to give the floor to some of our speakers here. We have here Gokul Rajendran, that is an expert of indigenous knowledge, indigenous medicine, and more than that, is important in this particular COP that is holding in Brazil to give value to the indigenous medicine. So I want to give the floor to Gokul, because I know that after that he has another event very important on traditional medicine. So I kindly ask also the other speaker to give precedence to Gokul. So Gokul, please, the floor is yours.
Thank you so much, Domenico. Thank you so much, One Health team, and thank you so much for all of who joined online. And also thank you so much for everyone who came in person as well. So yeah, thanks for giving me the floor. So I'd like to start with saying some most important things in indigenous and traditional medicine for climate and health is something that we need to start acting upon as soon as possible. Because even One Health, it's like not significantly adding more into the traditional and indigenous knowledge side. So we are trying to actively advocate for adding this indigenous and traditional medicine both across One Health, planetary health, and also like human health spaces, and also across the UN space, because indigenous knowledge is something really important that people are recognizing right now. But it's like really in a verge of situation, like everyone is confused of how can we integrate that information, how can we take it forward. So that part is like really always like having a lot of issues. So that is something like really I think really important that we need to work together on this thing. That's why something like what we are doing right now is like really important. That's really important, because other than you guys, I have never seen anyone else do the same work. So it's really really something that you guys provide a space for the indigenous communities to speak on, like providing them a guideline how to work, like a future like COP, which is like which is like a space which is like very much overwhelming with different topics and everything. But indigenous people often come here and get confused about how, what, and everything that we should like advocate for. And according to health and traditional medicine side, I would like to say like I'm an Ayurvedic student back in India, and we practice traditional medicine, which is directly linked with climate and health. More than the Western medicine, which is advocating for climate and health, we have like loss and damages as well for indigenous and traditional medicine, because forests or medicinal plants are being affected. It's like dying off, and the chemical properties of the plants that we find right now is like diminishing. So it is affecting our medicines that we make. That is something like really alarming for us. And the second thing is that the environment around, when we treat someone, like even in Chinese medicine, or even in Ayurveda, even in like Australian medicine, or in African medicine, environment is a key factor. Without environment, you cannot completely cure a person. So if you are giving a medicine to a person, we need to take care of like the environment is a key factor for which medicine should be provided to that person. So if the environment is unpredictable, or it's like too hot or too cold, then that will be affecting the person's health, and also the treatment that we give will not be effective. So people will be like, okay, indigenous medicine is not working, I should go over to Western medicine. That will be promoting people to go into westernized medicine, like taking like paracetamol and other things that will cause antimicrobial resistance and all that stuff. So we have a sustainable way of treatment, and it is under threat. And indigenous people should acknowledge that thing. Like it is like something which we should hand it over to our children and grandchildren, and promote them within our community, our family, to keep it alive, so that it is also an indicator for climate and health, like how climate changes, it also changes. So yeah, I think I would like to really highlight this point of how like to protect our indigenous traditional medicinal knowledge, our elders who are right now here, our indigenous people who are here, who are like have some knowledge about how they should use like the medicinal plants around them, to be taught to their grandchildren, students, and they should like help them use that for their daily purposes. Because if the trust is gone, as an indigenous doctor, they come to us, but once the trust is gone, they will never trust us again. But it's different for a family; they can change the people. So that's it.
Thank you very much, Gokul, and thank you for reminding the importance to recall on indigenous knowledge and also find a way on how the modern science can talk with this type of.
I would add something more as well. So we have been like here. I was talking to the UNFCCC director, and of like director. She was like really excited for this, because in the agenda of UNFCCC, traditional medicine was popping up. So they want to know how to fix this thing in the agenda thing itself. So there will be something soon coming up with UNFCCC. So fingers crossed.
Yeah, thank you, Gokul, for sort of this insight, and we are hoping that this can come very, very soon. But to honor the place where we are just in the front of Amazon. And we have to recognize that we are in one of the most biodiverse country in the world. We are touching biodiversity, and we are seeing the biodiversity of this place very, very, very strongly. And we presented this position paper also last year, and we had a special guest that is today also with us, that for sure is very linked to biodiversity. And to homage today and to honor really the presentation of this position paper, I want to give the floor to Cristina Romanelli, the One Biodiversity Unit of WHO, that is here with us. Thank you very much, Cristina, for being back with us. It's passed 1 year where we were presenting the position paper of last year, and here we are back with another effort and another position paper on integral ecology and 1M. So I'll give you the floor for your speech. Thank you very much for being with us.
Thank you very much, Domenico, for the opportunity. In fact, distinguished colleagues, dear friends, fellow panelists, it's such a pleasure to join you, even virtually, from the WHO Department of Environment, Climate Change, One Health, and Migration, where I'm the biodiversity and health focal point. I'd also like to underline that I work very closely with the WHO Global Center for Traditional Medicine, so building on the presentation that we just heard from Gokul. But I have to begin with a warm thanks to the organizers for convening this timely conversation on One Digital Health, Integral Ecology, and the SDGs here at COP30 in Belém, particularly on Health Day. and as a follow-up to the exciting Fourth International One Health Conference, which I had been pleased to join in Rome. And as you were saying, Domenico, Belém couldn't be a more meaningful place to hold the dialogue. The heart of the Amazon is actually a living illustration of how our ecological, cultural, and digital health futures are intertwined. The Amazon regulates rainfall across continents, stabilizes the global climate, sustains extraordinary biodiversity, and supports the health and cultures of millions of people. But it's also a region where social and digital inequalities remain stark, where environmental pressures are intensifying, and where health systems are already strained by climate change, infectious disease risk, and loss of ecosystem resilience. So, Brazil is not only mega diverse in species, it's also pluriversal in worldviews. It holds the largest share of the Earth's biodiversity, the most extensive tropical forest, and really, really rich mosaic of indigenous knowledge systems that have stewarded these ecosystems for really millennia. And I'd say that, it really is here where the living fabric of life and knowledge is so deeply interwoven that digital innovation can meet ecological ethics, and where One Health can harmonize with integral ecology. So at WHO, our work on One Health is guided by a simple truth reflected in the OLEP, here I am with my acronyms, the One Health High-Level Expert Panel definition of One Health, and adopted as the common definition by all of the quadripartite agencies. So One Health, so we're on the same ground, is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animal, and ecosystems. And it recognizes that the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. And integral ecology, as it was articulated in Laudato Si, and also echoed in indigenous worldviews, goes further in reminding us that everything is connected: the ecological, the social, the cultural, and the spiritual. So I'd say that one digital health serves as a bridge between these two perspectives, applying the integrated vision of One Health and the ethical grounding of integral ecology to how we generate, share, and govern data. It rests on a simple understanding. Data is actually relational. It's not siloed. Patterns, feedbacks emerge across systems, not within single sectors. And that the health of human populations absolutely can't be disaggregated or separated from the health of animals, plants, soils, forests, and climate systems. So digital innovation offers powerful tools, but it also carries costs and responsibilities in energy, in equity, in safety. Its role within One Health is to enhance our awareness of connections and our capacity to act responsibly, not to substitute for the wisdom and balance that we find in nature. But when it's grounded in ethics and ecological responsibility, digital innovation can help operationalize the Sustainable Development Goals, because early detection, primary prevention, climate resilience, and ecosystem stewardship all rely on timely, interoperable, inclusive data ecosystems. I'd say that despite major advances in digital health, biosurveillance, genomics, and environmental monitoring, the world still faces deep structural challenges. Human health data is rarely integrated with animal health, plant health, soil health, meteorological, or even environmental data. And climate and biodiversity data sets remain largely separate from the public health decision making. Many AI models at the same time are trained on human or clinical data and lack ecological inputs such as land use, climate, biodiversity variables, limiting their ability to capture upstream drivers and root causes of health risks. We also have to remember that most surveillance systems detect crises only after they've already escalated. And very importantly, digital access remains deeply unequal, reproducing the same inequities that we're trying to solve. But this fragmentation, I'd say, is one of the many reasons for which 70% of emerging infectious diseases still originate at the human-animal ecosystem interface. Climate change has been projected to cause an additional 250,000 deaths annually between 2030 and 2050. And still 1 in 4 premature deaths globally are attributable to preventable environmental factors. So I think that we're at a stage where we simply cannot meet the SDGs, including SDG 3 on health, 13 on climate, 14 on biodiversity below water, and 15 on land, or the broader 2030 agenda without integrating data across these domains. One Digital Health isn't a new platform, I'd say. I'd say it's a new way of organizing knowledge. A One Digital Health ecosystem integrates health informatics, veterinary and animal health data, environmental and climate monitoring, biodiversity surveillance, land use and cover forest analysis, zoonotic risk mapping, community-based science, AI-supported early warning systems. And through this integration, we gain earlier detection of zoonotic spillover, vector shifts, and climate-sensitive diseases. We also gain better prediction of wildfire smoke impacts, heat-related illness, crop failure, antimicrobial resistance. Potentially more equitable adaptation strategies that can be rooted in rights, knowledge, and stewardship of Indigenous peoples and surrounding communities, and certainly more coordinated responses that reach across ministries, across disciplines and borders. But the fundamental question becomes, how do we turn digital innovation into digital solidarity? Because data mustn't only be interoperable, it must be shared, governed ethically, and accessible to all. So I think integral ecology gives us an ethical compass for digital transformation. It teaches us that knowledge is indeed relational, that governance must be inclusive, and technological progress has meaning only if it strengthens both people and our connections to them and the living world. At the same time, Indigenous knowledge systems, including those from across Amazonia, remind us that data is not neutral. It carries relationships, responsibilities, and rights. So as we build One Digital Health systems, our digital ethics must reflect ecological ethics. That means transparency, reciprocity, respect for data sovereignty, equity and access, and the protection of vulnerable populations and ecosystems. And this is especially true as we integrate AI into biosurveillance. AI can illuminate patterns we cannot see, but it can also amplify bias if it's not governed responsibly. Therefore, it has to be explainable and accountable and ecologically literate, incorporating environmental, climatic, and biodiversity variables, not only clinical ones. Ethics can't stop at data governance. It has to extend to safeguards for Indigenous peoples and traditional knowledge systems. As digital platforms integrate biodiversity, health, and cultural data, we must ensure that intellectual property rights, free, prior, and informed consent, and Indigenous data sovereignty are upheld. So traditional knowledge is not an open source data set. It's living heritage. And any digital use has to respect the custodianship and consent of the communities that hold it. And WHO and our partners also recognize that One Digital Health must embed safeguards that are also inspired by or coherent with the Nagoya Protocol on Access and Benefit Sharing, the UNDRIP or UN Declaration on the Rights of Indigenous Peoples, and the WIPO, ensuring that data sharing never becomes mere extraction of data. Right? And so what's our role at WHO within this? Within the eco department at WHO, our role is to support member states by providing normative guidance for One Health data governance, by supporting the development of One Health early warning systems, and convening quadripartite partners, so FAO, World Organization for Animal Health, UN Environment Program, and WHO, around joint analytics and risk assessment. It also is about developing metrics for climate.
Oh, no, Christina.
Yes.
Sorry. Okay, if you can go to the conclusion just for quickly.
I'm sorry, I couldn't hear the question.
If you can go to the conclusions.
Sure, absolutely. So to the conclusions, I'd say that, let me go to the recommendation or to scale One Digital Health. I believe that we need at least 6 enabling conditions, and I think we can focus on those. So that's an interoperable data architecture across disciplines, sectors, and ministries. Second, shared governance frameworks that protect privacy, sovereignty, equity, and intellectual property rights. Third is investment in public digital infrastructure, not only privately owned, but digital infrastructure. Fourth, capacity building that trains scientists, clinicians, environmental experts, AI developers, and policymakers to work both capably and responsibly across systems, and that enables citizen science and participatory learning to ensure that data ecosystems benefit from community knowledge and real-world insights. Fifth, digital inclusion strategies to ensure that Indigenous peoples, rural communities, and marginalized groups are not left behind. And sixth, a robust ethical framework and safeguards to ensure that knowledge, including Indigenous traditional knowledge, is not extracted, misinterpreted, misappropriated, or misused. These are, in my view, the first essential steps to a more equitable, responsible, and ethical use of digital technology in One Health moving forward. And that One Health digital technology must therefore be governed not only by algorithms, but by equity and accountability. So those data infrastructures must be co-created within communities, not imposed on them. Otherwise, we perpetuate those same structural inequities I referenced before that drive biodiversity loss and poor health outcomes, and ensuring that those would actually be replicated in code. So the position paper presented for this session reminds us that integral ecology and One Health is not only a scientific imperative, but a moral and a policy one. And WHO's work, in essence, seeks to support and translate that shared vision into global practice. So with that, I thank you so much for listening, and happy Health Day in Belém.
Thank you very much. A big applause for Christina. Thank you really for your passionate intervention, and thank you very much for sharing also these other points that we will add also to our position paper. Sorry for the mind keeping as a moderator. I have this role, unfortunate. And on this, I also want to give the floor, connecting with the intervention of Christina, to Ariel Venice, because we are in the Digital Innovation Pavilion, and it's important today not only talk about One Health, but One Digital Health. And Ariel is one of the researchers that has developed this concept of One Digital Health. Ariel, the floor is yours. Just kindly ask also to all the speakers to stay in time. Unfortunately, we have just 1 hour, so please, the floor is yours.
Hello everyone. Thank you for the invitation to join this panel. Christina, Romanelli, thank you so much for giving your vision of One Digital Health. I'm glad to hear this vision, considering that when we started with my partners in 2019 to build this One Digital Health framework, we never expected to see it as much as shared worldwide as you pointed out today. I will share my screen for a short presentation. Yeah, can you hear me?
Yes, you have to share eventually from the app. Okay. I don't know.
Yeah.
Okay. Perfect. We can see.
Okay, great. So One Digital Health is, at the end of the day, the merge of the One Health approach and the Digital Health one. For the anecdote, when we started to think with my partner in crime, Dr. Asghar Tambouris from Italy, to think to One Digital Health, we discussed just after a session when I introduced problem-based learning approach to introduce medical informatics, veterinary health to industrial engineers for supporting them in developing new products, and so taking forward innovation. And he presented an approach to educate medical students to health informatics. And then we started this great journey. In 2021, also with additional partners, we built the One Digital Health framework, which is modelized here with this figure, when you can see two keys, the One Health and the Digital Health one, with three perspectives: the individual one, because we need to look at the individual, but the individual can be a human or can be an animal. The population and society, because we need to think about interaction, about groups, and in an ecosystem. We are looking today also at urban environment. You have also on this slide the reference to the seminal paper on One Digital Health that we published in JMIR, the Journal of Medical Internet Research, in 2021. Excuse me. Freely accessible. So the main point when we are looking at One Digital Health, and I will give some more accurate perspective from our side here, we have five dimensions that we are looking when we are dealing with One Digital Health. We need education and citizen science, meaning that we need also to develop platforms allowing to educate not just academics, but from the kindergarten to the continuous education for healthcare practitioners, engineers, managers, and so on. And to educate the population, we need a citizen engagement. We need each one involved in sharing data, in analyzing data. Similarly to the city program, if you remember, for a part of you, supported by the NASA during the 90s. To discover life in the universe. So here we have exactly the same thing. We need to collect data for any environmental event, health event, and so on, with applications or mobile applications with platforms involving the citizen. And so when we are looking at the citizen, we are also looking at the healthcare system. We need to integrate not just human and veterinary data, but we need to have an integration of the human, the veterinary, the environmental data 24/7. My dream when we are asking if a patient has a physical activity is to ask also if he or she has a pet, because having a pet is involving taking it outside, walking, having some physical activity, and also knowing exactly what the psychological impact of this interaction. Also, monitoring a pet is giving us a lot of information about the human mental health and physical health, and reciprocally. It's taking us to the digital transformation, and that's the main point. And I will insist with the point of Dr. Romanelli regarding interoperability. We have a big issue. It's not just interoperability of IoT devices with platforms, but it's also sharing data between health management organizations, between governments on health data. And so we need to have a digital environment, meaning that we are looking and monitoring nature, human life, animal life, but we need to have sensors and actuators everywhere in an interoperable way and supporting fairness, the fairness of the data. So when we are looking at the figure we have here, you can see, as I introduced it previously, 3 layers. The one of the keys, we can look at One Health and digital health in 2 different ways. But when we are merging them as one digital health, we need to look at the individual, the population, and the ecosystem, following the 5 dimensions that I described here again, and combining always the individual with the ecosystem, the individual with the population, the ecosystem with the population. So all the combinations that we can have here through the technological ring, the interoperability, the fairness of the data through this technological ring. So not taking too long with this, but we have
technical problems. I don't know. Ariel. We cannot hear Ariel anymore. Ariel, are you there? Yes, we have some problem with Ariel. Okay, so in the meanwhile that maybe we take back Ariel. Let's maybe go 1 second to the position paper. So we will give the floor to Ariel back. I want to give the floor now to Dylan Feldman. Dylan Feldman is a student of the Metabolism Cities Living Lab at IS Foundation that has worked properly on drafting the position paper. So very quickly, Dylan, I want to give the floor to you, and I ask to put the presentation. Dylan, please highlight us about the drafting of the position paper, and then we will go to the points. Dylan, okay, please, the floor is yours.
Okay. Hi there. Thank you guys all so much for listening in this is the One Health position paper framework, very similar to what Christina Romanelli of the WHO was talking about. The framework for the One Health position paper is very closely intertwined, all 7 points. Moving on to the next slide. All 7 points that we have are very closely intertwined and interconnected in order to create a cohesive environment of climate sustainability, environmental sustainability, social sustainability, and social equity and justice. So going through all 7 points, we have the integration of One Health frameworks, the application of systemic thinking, the promotion of community-based and indigenous knowledge systems, strengthening multilateral cooperation. This can be done through a number of ways, through local governments, indigenous cooperation, communicating with constituents, the support of education, research, and innovation funding, the establishment of One Health indicators within the UN and WHO and across the whole board, and the fostering of interdisciplinary collaboration and environmental stewardship, tying back into the Laudato Si and Integral Ecology framework and ideals. Moving on to the next slide for the recommendations of these 7 main points. Though they are separate ideas, they're all deeply interconnected and intertwined with each other. With the start of integrating One Health frameworks, recognizing the interdependence between human, animal, and environmental health all across the world, especially as we can see in Belém, Brazil, with indigenous tribes, and how we can really see that they integrate and communicate and integrate with each other. As we talk about going back all the way to 1987 and the writing and publishing of the Brundtland Report, also known as Our Climate Future, really emphasize sustainable development and safeguarding present and future generations without neglecting the needs of the most vulnerable when it comes to climate and environmental sustainability. And by integrating One Health into food systems, biodiversity protection, and disaster response, we can create more resilient, equitable, and sustainable adaptation strategies across the world at different nations, states, and territories. And by doing so, governments can strengthen public health, prevent, like Christina said, zoonotic spillover, and reinforce environmental systems that can sustain all life. And moving on to the application of the systemic thinking approach, going back to the recently written IPCC AR6 synthesis report, it reminds us that climate, biodiversity, and human well-being are closely interconnected and intertwined with each other. So we have to move beyond isolated policy interventions and essentially band-aid legislation that can solve issues in short time periods, but in the long run, it's not going to help us solve like the key crux and roots of the issue. It's just helping to essentially stop the bleeding, quote unquote. Systemic thinking allows us to really address all issues at once by thinking of different ideas and parts of environmental like destruction and injustice and degradation as a living, breathing being, whether it be social, cultural, spiritual, environmental, or financial. Everything is interconnected within each other, and they all have a deeply intertwined connection and effect on each other. And moving on to promote the promotion of community-based and indigenous knowledge systems that we heard a lot earlier on, the empowerment of local leadership in resource management, strengthening social equity and custodianship of natural environments. We can see across the world and across so many different indigenous cultures that the protection, sustainability, and connection with the environment is such a strong identity that the promotion of that is super important in terms of getting it out to the general public and giving a leadership position and a voice to these indigenous people in order to protect these lands that have so long been held sacred. And moving on to the last 3 points of the supporting education, research, and innovation funding, we need to really funnel a lot more resources into putting out that information that we have put into paper, like position papers like ours, into the world, but also so constituents and people without a scientific background are able to read it. And by doing that, by putting more resources and funding into this social and sustainable innovation when it comes to the environment, we are able to really kind of disseminate the information across the globe, so more people can get access to it. And with the establishment of One Health indicators, similar to the Lancet Countdown Report, which continually is currently being released with a new version, it will allow us to create a systemic and interconnected, essentially, set of data points where we can monitor climate-related statistics across nations, across governments, and across cultures. So in order to increase transparency and accountability across all member states of COP and One Health. And finally, by fostering interdisciplinary collaboration, either when it comes to either scientific, social, cultural, or spiritual, it'll really allow us to keep our alignment with integral ecology of the utmost priority and importance, and really underline the importance and bring about like more environmental sustainability. Thank you.
Thank you very much, Dylan. And now here there are the 10 points that we want to present today. I will not explain each one of that. You can just see, but we are facing all these arguments also with the different speakers. The systemic governance, the climate health nexus, the science policy interface, the digital and technological innovation, restoration, and ecological conversion. These are 10 points that we are bringing, and we want to propose this to the policymaker. We want that this point can enter also into the negotiation space. We want to go to the next slide, please. From these 10 key points, there are some policy implications, okay? And in fact, we want that these points can fall into, for example, integrate One Health into national climate action plan. That's very important. One Health and health is also part of the adaptation. Apply systemic cross-sector thinking. Systemic thinking is the radical change. We have to not think anymore inside the box, but outside the box, try to bring in and creating synergies. Also, as recalled by the IPCC, strengthen multilateral governance, foster interdisciplinary and inclusive climate solution. We cannot save each other all alone. We cannot just as professionals think that we cannot collaborate with other disciplines. We have to do that. Develop One Health indicator, of course. And again, I want to reiterate once again, promote indigenous and community-based knowledge. This is the key and radical changing point. If we are making a dialogue with indigenous knowledge, we can really foster new we can say, scientific knowledge, but also new knowledge that we can use for face climate change. Next slide, please. So, next slide, please. So, we were talking about integral ecology. We will talk about also a radical change that is starting from a social conversion, ecological conversion. It is a cultural and educational transformation that is passing through education, so educated generation, to change the narrative. We have also to change the narrative from eco-anxiety to eco-hope, and of course to make economic choices. One of the main topics here in COP is climate finance, like how to implement financial solution to tackle the climate crisis. This vision can also be implemented for the One Health, and One Health can also be part of new economical choices. And so these are the proposals that we want to bring today. We are going to launch today this position paper. It will be available, and we can share also with you a copy. Let's go to the next two slides. It's important for us that if you accept this point, you can also follow our ethical code. We developed inside the scientific committee of the One Health a strong ethical code to bring also in choices what we talk in knowledge, what we are bringing as knowledge sharing. And if you want to know more about us, you can go to the next slide. You can also reach out on our channels, on our website. You can see also the different edition of the One Health and also our conference of this year. So I will not spend any more. I wanted to give the floor to the last guest. First of all, let's finish Ariel. I kindly ask Ariel to finish very quickly the presentation, and then we will give the floor to the protagonists, the creators of the position paper. But first of all, Ariel, please, the floor is yours.
Yeah. Can you hear me now?
Yes.
Yeah,
please.
great. Thank you so much. To confirm. So just to conclude very shortly and to allow to go forward, One Digital Health is a very complex system. It's a very complex framework at the end of the day. And we need to look at health organizations to support this framework and this journey. But from my perspective, and that's the critical point here, on November 4th, we have the One Health Day. And that's the main issue. Most of the population, of the citizens, of the professionals are not aware about this, are not aware about the concept of One Health, are not aware that digital health is not just the application provided by the health organization to schedule an appointment with a physician, with a nurse. We need to educate, we need to share this knowledge about One Health, to improve the literacy about digital health, and to educate also the educators to One Health, digital health, and to this framework of One Digital Health, to allow each one to contribute to the data collection, to the data analysis, and to the policy development, allowing us to support the decision makers to take the right decisions, not just for our human health, but for the global health and planetary health. So thank you so much for the opportunity to contribute here. And very, very last point, One Digital Health is also looking at green AI. That's great to program and to analyze data, but we need to do it in the right way without hurting the environment. AI is not a clean tech. I'm 25 years dealing with AI, and we are running a lot of times our analysis to get something correct or that can support the decision makers. But it's not something clean. We need a green and clean AI to support One Health, to support One Digital Health. Thank you.
Thank you very much, Ariel, also with this message that I think is very important to record this venue. I'm chair of the One Health, but I'm not alone, because together with me there is a Professor Margherita Ferrante that is co-chair of the International One Health Conference, and I greet Margherita and thank her for being here. Margherita, it's been a long journey. We did also this year. I want to give the floor for your remarks. Thank you, Margherita, for being with us.
Thank you, Domenico, for this opportunity to be here in COP30 in Amazonia. I would like to thank also all the organizers for the great opportunity to present our group. And the One Health Conference group was born in 2021 with an online conference and the aim of spreading the culture of the One Health approach in a planetary health vision. And in fact, from then to today, it welcomed many associations and groups of professionals from all over the world who grow year after year and strengthen the diffusion of the One Health approach in the world. You can see here University of Catania, the San Diego University, and the East, and many other groups that make part of the International One Health Conference. The first in-present conference was in Catania, hosted by University of Catania. The second was in Barcelona, hosted by Colegio de Médicos of Barcelona. And you can see here the 5 main dimensions of the Congress. And the third international, how Domenico have previously said, was in Athens, Greece, hosted by European Public Law Order. And then the fourth in this year, in October 2025, was in Rome, hosted by Campus Biomedico of Rome. And the leitmotiv was Integral Ecology as light to advance the One Health vision. And 4.2c was, we mean when we talk about One Health approach in planetary health vision, we can see the plastic model. Plastic is one of the more urgent topics in this moment, very actual and very emergent. And you can see that plastic are spread all over in the world, in soil, water, air, in living organism, also in human body. There is a very concern for the public health at this moment. And the way to fight plastic spread is not only to reduce plastics, but to work in all over the environment, in abiotic and biotic environment, and to see terrestrial ecosystem services, global scale distribution, and marine ecosystem in light of the environmental health and the human health. So we have to reducing plastic consumption, improving waste management, finding sustainable alternatives to single-use plastics, but not only, because only working on the plastic issue across all 17 Millennium Development Goals, we could achieve climate neutrality by 2050. You can see that plastic concern is all over the 17 SDGs. So to work hardly on this in the light to manage correctly the plastics and to reduce, to avoid the consequence on environment and human health is very important. This means integral ecology. And today is the Kidneys Day. And the kindness and the respect are two main value for to have everything connected in an integral ecology view. And so we can say that have said Pope Francisco, have said Domenico, and Pope Francisco said that we are little, we will help make our common home more habitable and more supportive, more cared for, a home where no one is rejected or excluded, but where we all enjoy the goods necessary to live and grow in dignity. So thank you very much for this opportunity.
Thank you very much, Margherita. Thank you also for highlighting the problem of plastic. There is also another big challenge that is connected to climate change, and together, as I say, in an holistic point of view, we have to address properly using the One Health approach. And so I know that for the sake of time, she has to leave, but I want to give the floor to Roberta Ianna now from the MASE, that is the Italian Ministry of Energy Security and Environment, but also she is focal point of action of climate empowerment for Italy, probably highlighting the education, the role of education also on One Health. So, Roberta, thank you very much for being with us. Thank you for the patient. Just kindly ask the speakers now, we have just 10 extra minutes. Thanks for Miro that has given us a little bit, but please stay in time. The floor is yours, Roberta. Roberta, we cannot hear you. I don't know if there is a problem in the audio.
Can you hear me?
Yes, no, yes.
Now you can? Okay, sorry.
Yes.
So, yes, thank you. So just wanted to say again to you, Domenico, and the Digital Innovation Pavilion, thank you very much for the innovation, the invitation, the opportunity to be with you virtually, and for bringing to the table this important topic of the impact of climate change on health and the importance of digital innovation, how to advance on climate change action, climate action also in the health space. And I will be very brief and about education, bringing just two considerations to the discussion. One, of course, the importance of capacity building and the involvement of young people's creativity on this space, and very timely and actual topics such as digital innovation and health. And so in this regard, as this is with my hat of senior expert at the Ministry of the Environment and Energy Security of Italy, very proud of the Youth for Climate initiative we launched and are co-leading now with the UNDP, which is funding project proposals from young people, and since this year also a project proposal specifically on digital innovation. And we received in this year call for solutions, lots of proposal also related to health system, how to improve health systems in different countries through digital innovation. So it's definitely a sector, a topic which we will give more space to also in the future, with also a specific window on digital innovation for health. And so this is regarding the Youth for Climate initiative we are co-leading with the UNDP. And the other issue I would very quickly mention now is related to ACE, Action for Climate Empowerment, as agenda item of the UNFCCC negotiations, and talking about the position paper of One Health that you just presented. I think it could be a good opportunity. There will be a good opportunity next year in the negotiation to bring One Health and digital innovation into the discussion, because there will be next year in the agenda of the UNFCCC on matters related to ACE, to Action for Climate Empowerment, a discussion on a new action plan. There will be the midterm review of the Glasgow Work Programme of ACE, and the discussion of for the implementation and the realization and implementation of a new action plan on ACE. So lots of topics will be addressed and added to the current action plan, which will be reviewed. And so I invite you to participate in the discussion, because of course the negotiation itself it's open only to governments, but observers are admitted, and particularly admitted to send submissions with topics they would like to see in the discussion. And the negotiation on ACE just concluded yesterday at this COP, and you can see in the decision text there is a call for submissions by the end of March 2026. So this is like an invitation to contribute to the discussion. It will be a call for submission to inform and suggest topics and send inputs for a workshop that will take place next year in June in the Bonn session, to address and discuss the review of the Glasgow Work Programme and the new action plan. So I think it could be a good opportunity to really bring into the discussion the topics of One Health and the position paper you just presented. So I think I hope I've been brief enough, and thank you again for the invitation.
Super brief and super dense, also a lot of information. Thank you very much, Roberta, and we will follow your suggestion. Thank you also for suggesting us to bring the position paper in the negotiation level. That actually is the role of the event of today. I want to give the floor now to Dr. Gabriela Fernandez, that is the director of the Metabolism of Cities Living Lab, is a colleague, also I work there, and together we are also focusing on One Health at the frontiers and the borders. So Dr. Fernandez, the floor is yours for addressing this topic that is also very important for the Latin American continent.
Thank you, Domenico. Good morning, everyone, friends, colleagues, and also thank you again to the Digital Pavilion. I'm happy to be here at COP30 and giving us the opportunity also to discuss this very important issue, focusing on the bond between humans, animal, and environmental health. I am a professor at San Diego State University. I teach master's students in big data analytics. I'm also director of the Metabolism of Cities Living Lab, where I work closely with Dr. Domenico Vito, and also one of the organizers for the One Health International Conference. So now we recently discussed the 10 different key elements of the position paper for the One Health International Conference. But now something to think about is, how do we transform these grand visions and policy recommendations into measurable, just actions on the ground? So the answer, which brings us to the core of this roundtable, lies on the One Digital Health. And I think it was discussed previously in the power of data. So in our own research with Metabolism of Cities Living Lab, we work on the topic of urban metabolism, where we analyze cities, the engines of our global systems, not just as physical spaces, but as complex living organisms, comparing the city to something that is alive. We trace the flows of energy, material, and resources to understand the immense environmental impact, and more critically, the deep social injustices. So part of the SDGs is making sure also that no one is left behind. So this is where the digital element is transformative. We use big data analytics, not for efficiency, but as a tool for ethical accountability and social justice, directly addressing the UN Sustainable Development Goals, which are about the year 2030, which is very soon. So we integrate these massive data sets to identify vulnerable communities, the groups of people who are systematically underserved, who lack data representation, which is very important, and whose suffering from climate change and ecological collapse remains invisible in national policy currently. Our work is dedicated to giving voices to those that are currently being left behind. COP30 couldn't have been in the most perfect place in the entrance of the Amazon. By analyzing the metabolic flows of the city, we can pinpoint areas where environmental degradation and human health crisis overlap, ensuring that the One Health policies are targeted precisely where the need is the greatest. So the position paper that we presented today calls for governance. Our work calls for the data to back that governance. Integral Ecology provides the ethical framework, and digital health provides the operational lens. Let us use the power of digital innovation, not just to monitor emissions, but to monitor equity. Let us ensure that our commitment to One Health means that we protect the planet. We are, without fail, protecting the most vulnerable people on it. We urge our leaders at COP30 to champion our 10 key points in these negotiations, and to join us in fostering a renewed synergy, across ethics, ecology, and data, to secure global climate resilience and ecological justice for all. So thank you again to the Digital Innovation Pavilion for allowing us and giving us the stage to showcase our work. And thank you very much to all the other speakers.
Thank you very much, Dr. Fernandez. Thank you for your powerful words. Let's not forget about equity. Now, let's really go to the conclusion with Jordi Serrano-Pons. One Health is very connected to the planetary health concept, and Jordi is like the CEO of the Planet Health Innovation Network. So, Jordi, the floor is yours to close this amazing session. Thank you very much for being with us.
Thank you very much. It's a pleasure to be with you, and congratulations for all the work and the presence in the COP, and congratulations for all the speeches, but not only speeches, actions in all your cases. We set up this Planet Health Innovation Network, a nonprofit. We have been setting up different conferences. The last one in Rome, thanks to One Health International. We thank you a lot for that possibility. And basically what we want is to enhance, to foster innovation in global health, One Health, and planetary health. There is, of course, a super overlapping on these specialties. And basically, they're not investors dedicated for antibiotic resistance kit that really already exists. Antibiotic resistant kit for bacteria in the public plants of water in the cities, and so on. So many innovations, already physically existing innovations that are not invested because are not attractive by the market. So in that sense, at Planetary Innovation Network, we want to foster activities, and we believe that there should be some mechanisms to instigate, to promote some big funds to accelerate these innovations or in this transversal way. Just to finish, there is a lot of, I have set some list of different tools. For example, there is existing tools, an example, a community-based early warning system using mobile health apps. Low-cost mobile apps developed in rural communities already exist. Some citizens can report symptoms in humans, in livestock. That's an example. Another example, integrating environmental monitoring sensors with primary care systems already wherever air quality sensors or community environmental station feed data exists. Connecting that with primary care dashboards, correlating pollution or systems to monitor mortality in heat waves during summer. AI-driven One Health decision support for local governments. Some of these tools exist. The question is that are not implemented massively, of course, not scalable. So tools to really report mosquitoes in zones that did not exist before. So many things exist. So basically, what we want to do is really foster this innovation, especially from primary care, because it could be really a pile, really the system where all these things could collide, no? And with digital tools from there, unlock the global value in there. So just to finish, digital innovation must be inclusive. Without digital equity, of course, from our point of view, there is no One Health. Interoperability is not, as our friend that probably is listening to us, Dr. Pedro Albajar from WHO also. By the way, amazing speech by Dr. Romanelli. Congratulations. And interoperability is not a technical challenge. It's really a governance challenge nowadays. No? So I think we have to really make governments talking together, but governments with entrepreneurs, and basically regulators must really understand the necessity and the velocity that we really need to really use the AI aspects and all these capacities in the best possible way, maintaining equity, but also at the same time allowing innovation in all these fields. No, and basically just to finish, I would say that One Digital Health give us the tools, One Health give us the vision, and Integral Ecology, for example, the lemma of the last conference, give us the compass. No, and at Planetary Health Innovation Network, we would like to give the momentum to accelerate and implement these solutions where they are most needed. No, thank you very much. We will do more of this conference of Planetary Health Innovation, and thank you to everybody.
Thank you very much, Jordi, and thank you very much to all the speakers. And thank you also to the Digital Innovation Pavilion for hosting us, to Middle Forcer and all the guests that is intervening. So if you want to know more about the position paper, we are available to give a copy and to, like we are here, how to discuss. Thank you very much and have a nice health day together here in COP. Bye.